Hi everyone, welcome to the first episode of Etiqa Unfiltered Vodcast. And for this month, of course, it's going to be Pinktober. Let me introduce our guest for today. This is Dr. Vicky.
Hi everyone, thank you for having me here today.
So Dr. Vicky is actually the Deputy Medical Director at NCSM. NCSM is actually the National Cancer Society of Malaysia, and she specializes in public health. All right, so for today's session, we're going to be talking about some myths that we can bust about breast cancer, and then some tips on how we can test for early detection, and a lot more. So keep on watching and see what you can learn today. So Dr. Vicky, can you tell our audience why is Pinktober so significant and why should we pay more attention?
Okay, so thank you for the question, Joey. Pinktober actually this concept started back in the 90s. And this was an initiative taken to sort of create awareness among women globally and also nationwide to have more knowledge on breast cancer and its risk factors and when to do screening. So it's sort of now turned into a breast cancer awareness month. So the pink ribbon signifies breast cancer. So Pinktober is where nationwide we do screening, not only from the government sector, but also from the private sector, from corporates, from civil society organizations. Everyone take an initiative to hold hands together and advocate early screening and early detection among women in Malaysia.
Because when we talk about breast cancer, there's actually a lot of misconceptions or myths or facts that has been passed down for generations by our mother, our grandmother. So today, let us bust some of those. Okay, Dr. Vicky? All right, the first one. Is this a myth or a fact? Only women can get breast cancer.
So that's a myth because men can get breast cancer too. However, having said that, woman is the one that is commonly, associated with breast cancer because naturally men's breast density is much lesser and men has got no hormonal influence than the lady has. So yes, lady is more prone to get breast cancer compared to men, but men can get breast cancer too.
Okay, now you know, guys, men are at risk even though it's much lower than women, but there is still a bit of risk, all right? So the next one, having said that, is this a myth or a fact? Only women above 40 years old will need to worry about breast cancer.
That's also a myth because, this practice guidelines is coming from the ministry and the World Health Organization. So they set an age saying that, above 40, you should do screening. That is why we are detecting women to have breast cancer above the age of 40. However, if the screening age is reduced, as per the latest clinical practice guideline for breast cancer, it is reduced to 30 years old for women with higher risk. Now we are starting to see more ladies lesser than 40 years old to be diagnosed with breast cancer.
Wow. Okay. This is really alarming to me because this is what has been shared across everywhere that I've researched before I come here. It's like saying that, okay, especially for mammography, right? They say only 40 years and above, you need to do it. If you're younger than that, it's, you don't need to do it actually. Yeah, so that's crazy. Okay, myth or fact, breast cancer is always hereditary.
That's also a myth because a lot of women does not have family history of breast cancer and they can still get not infected. They can still get breast cancer. Yeah.
So, doctor, maybe to add on this, right? How about people whose family history has other history of other cancers?
Yeah. So generally, if you have cancer genetics in the family, yes, you stand a higher chance of getting breast cancer. All sort of cancers are associated because there's some mutation in the genetic level.
All right, and this one has been a talk in our office recently, which is deodorant and antiperspirant causes breast cancer. Myth or fact?
That's also myth because there's no studies or clinical trials that proves that deodorant usage or antiperspirant usage increases the risk of breast cancer.
Okay, so free to use deodorant antiperspirant, especially people taking public transportation. I think we should take it. We should use it. No worries there. Okay, sorry, doctor. I want to add on the 40 years old one, right? So, the risk of breast cancer increases above 40 with age.
Yeah.
So, but is 40 a significant number where you see higher cases or
above 50?
Above 50. Yeah. Okay. All right. So those are the myths and facts or misconceptions that I've heard around me. Are there any other ones that you'd like to share?
Plenty.
Or...
So one common myth is if ladies use wired bras, it has higher risk of getting breast cancer, which is a false myth.
Oh my god.
Yeah, it's a false myth because of course wired bras, if you have if you're using the wrong size bra, or if the material of the bra is not suitable for your skin, then yes, you might have some discomfort on the skin level but not on the breast. So it doesn't cause breast cancer. That's first myth. The other one, a common one, would be shaving, armpit shaving or waxing. Can it cause breast cancer? So again, there's no clinical trials that prove this.
Okay. So doctor, so breast cancer, is the risk known? Like, do we know what causes it or what kind of activities may lead to breast cancer?
Okay, so there are a few established risk factors. These are based on studies. So we have non-modifiable and modifiable risk factors. So I will highlight the modifiable risk factors first, which is, of course, nulliparity. Nulliparity means not having a child ever in their life. Okay. The other one would be prolonged hormone usage. So either through a hormone replacement therapy or for oral contraceptive usage. The other one would be definitely smoking and alcohol intake, because that generally increases the risk for all sorts of cancer, not only breast cancer. The other one would be a healthy lifestyle. If the person is, having a sedentary lifestyle, not doing proper exercise, not having balanced diet, not enough sleep, high stress, all this has been shown to have higher risk towards developing breast cancer. Yeah. Modifiable. Okay. Yeah. Non-modifiable would be things like aging. Cannot control. Family history of breast cancer. Genetic component called the BRCA1 and 2. So these are all in the genes and there's nothing you can do about it. The other thing would be breast density. So most women, you see, every lady has different cup size, right? Similarly, they also have different density, which is shown through the mammogram and ultrasound. So the higher density, or the more dense the breast is, the higher risk of developing breast cancer. Yeah. The other one would be not being pregnant, so no breastfeeding. So you see, the concept is if you are breastfeeding or if you're pregnant, the more pregnant you are or the longer you breastfeed, it halts the menstruation, you see. So the hormone associated with breast cancer is usually estrogen. Yeah. So estrogen is halted during the months where you're breastfeeding or pregnant. So it reduces risk. That's a theory that is, a lot of studies have shown association. Yeah.
Oh, interesting. So women who don't have kids are actually at higher risk for breast cancer. Oh, wow. You heard that, ladies? Okay. There's one question I wanted to ask. So when we talked about breast density, right, is it something that we can see externally, or it has to be shown by tests or?
Density and size of the breast is two different things. Yeah, totally different. So the cup size can still be, cup A, but the density could be type C. So it's not the same. So density is usually something that we can detect through the radiographic findings, mammogram, ultrasound. Yeah. Having said that, I also have another myth to bust. So you see a lot of ladies nowadays are using silicone implants. Yeah. So or they inject something in the breast or breast augmentation therapy. So this also does not have any clinical trials to prove that it is associated with breast cancer. However, it can cause infections, it can burst or rupture inside the breast, it can cause other sorts of problems. Yeah. Yes. Yeah.
Okay. So we are able to check the density of our breast when we do ultrasound or mammography.
Correct.
Okay. Okay, good to know. As we know, for any sort of cancer, but I think breast cancer, especially early detection, is really important. All right. So, could you walk us through like what kind of exams or tests that we can do on ourselves before we actually go to the clinic and get an actual test?
Allow me to define what is early detection first. So early detection has two components to it. The first one is screening and the other one is early diagnosis. So screening is when the lady has no symptoms and she's just coming forth for, just to check. That is what we're advocating. On the other side, early diagnosis means the lady has already faced some symptoms such as pain or discharge or a lump on the breast. So she's going to check. So that's called early diagnosis. Okay, so this is the difference between these two. Okay, so at home, women are encouraged to do self-breast examination. Okay, that is step one. Self-breast examination statistically does not have good sensitivity to detect breast cancer. However, we still encourage ladies to do it because that is step one. You know your breast the best. Yeah, so step one is to check. So how to do it? You can set a date every month. Okay, so I always advise to do it after menses because the breast is more softer after menses, about 5 to 7 days after the last day of menstruation. Yeah, so it's less painful when you do it. So you can do it during shower or you can do it after shower. You need to have a mirror. You have to face the mirror. So the step one is inspection of the breast. So you have to look at your breast, just see if there's any changes at all. So before this, we have been advocating things like, do you have a lump? Do you have a lump? So now it's just basically anything that's abnormal on your breast. If you feel it's abnormal, even though you can't come to what is it, you can't draw a line and see what is it in particular, but if you think something is wrong, just go and get yourself checked.
Just trust your gut.
Yeah, just trust your instincts. So for self-breast examination, I have a mannequin. So yeah, probably I can show you how to do it. So this is a mannequin. Okay, so I'm going to show you how to do self-breast examination. So use opposite sides. Okay, so if it's left breast, use the right hand. If it's right breast, use the left hand. Okay, so use these three palms because these three fingers on the palm. Okay, so they have better sensitivity to detect any abnormality. You can also use your thumb and pinky, but you see you can't feel. Yeah, so that's why we encourage using these three fingers. Okay, so the concept is you move from the center, okay, circular motion towards the outer layer of the breast. Okay, then you cover the center. Okay, you cover the top, you cover the bottom, and then you cover the sides, and then you touch the armpits as well. Okay, to see if there's any swelling, and then you repeat the same step for the other side. You can also do it through an upwards downwards motion, or you can move this way, vertically or horizontally. You can do that as well, as long as you cover the entire breast and also all the quadrants surrounding the breast. Why the quadrants as well? You might have that doubt. It's because of lymph nodes. Okay, so lymph nodes are usually also a precursor towards breast cancer. So if there's lymph node swelling, it's highly suspicious. Yeah, that's how you do a self-breast examination.
I think a lot of people watching and also me, we have this thing that we've always wanted to know, which is, yes, when we do the self test at home, we're doing it correctly, but we don't actually know what we are looking for. Yeah, whether it's a hard lump, a soft lump, how big it is, or is there any way to know?
Yeah, so that's why I always answer anything abnormal in your breast. If you think you feel a lump, you don't have to determine how abnormal the lump is. Having a lump that wasn't there before is already a red flag. Having a pain that wasn't there before, having some discharge that wasn't there before, some skin discoloration. If you think that the nipple is moving towards a certain direction, one breast is bigger than the other, any symptom at all that you think is abnormal is a symptom.
Okay, so maybe as a guide, right?
Yeah.
A normal breast, how does it feel when we do this motion?
Generally, it should feel soft. And there's no lumps and there's no abnormal skin changes.
Okay, because sometimes the muscle, there are some bumps as well.
Yeah.
Those are not lumps.
So you see, it's not safe to say it's normal or abnormal at this level. It could be abnormal. It's not safe for me to just give a blanket rule and say it's normal, it's fine. Because how can you determine at home that it's muscular or it's from the breast? That is why you do it. So once you do it, you have to go for further checkup with the doctor. They will identify and let you know whether this is breast cancer or not. In fact, painless lumps is the most scariest. Yeah. That's why I don't dare to say, oh, okay, painless lump, don't come and no need to check. This is just muscle. No way. You have to check. That's the only way to know. You have to come and see a doctor.
Better to be safe.
Yeah,
than
that's
to be sorry,
sorry,
right?
yes.
Let the doctor tell you that it's nothing, right?
Yeah.
A lot of people, I think they don't know the difference between ultrasound and mammography, So maybe you want to tell us more about the difference?
Okay. So, we go by the radiological sensitivity of imaging. So, for ladies who are lesser than 40 years old, generally the ultrasound picks up changes better than the mammogram. Okay. So, that is why we always do mammogram for ladies beyond 40 years old because the density of the breast is, more suited towards mammogram. But having said that, in Malaysia, if the lady is beyond 30 years old and she has risk factors such as, family history of breast cancer, or she's been diagnosed to have some other breast conditions in the past, or, all the risk factors that I mentioned earlier, that lady is warranted to do a mammogram regardless of her age. And WHO's guideline is you have to do the mammogram and ultrasound. Because it can pick up changes on both sides. Yeah, so don't stick to one. Yeah.
At what age should a lady start, going for breast exams or testing this kind of screening?
Clinical breast examination is advocated after the age of 30. And mammogram is from the age of 50 to 74 years old. Yeah. However, we are encouraging ladies to come forward at any age if they have symptoms or risk factors. You can check at any age, regardless of the guidelines. Yeah.
Okay, so ladies, you heard that. If you feel like you have the time or you want to know how your breast is doing, just go and get it checked. Don't think that, I'm too young for this.
Yeah.
Just go and get it. All right. How often should we do screenings like this?
So clinical breast examination beyond the age of 30 is done every 3 years in Malaysia, and mammogram is done every 2 years for ladies from 50 to 74 years old. However, if there has been any findings from your first checkup, then the frequency of checkup is based on your findings. Yeah. So you might have to do it 6 monthly, you might have to do it 1 year once. It's catered towards the patient.
All right. So my family, I think I have a history of cancers.
Okay.
Right. So my uncle had lung cancer and my mom had renal cancer. So am I at risk for breast cancer?
Okay, so your uncle and your mom had renal cancer. I'm sorry. Okay. So okay. So you see, your mom is considered a first degree relative to you. So that is a significant risk factor for breast cancer. However, your uncle is a second degree. Okay, so yes, risk is there, but a bit lesser. But your mom, yes, that's a significant risk factor. Family history of cancer. The other thing is the BRCA1 and 2. This is genetic component and it is tested through a blood testing. So ladies who carry these variants in their genes, they are definitely higher risk for developing breast cancer. Yeah. So how to check? When you're doing your annual checkup, you can just ask the doctor to include BRCA1 and BRCA2 in the checkup. It's like a tumor marker. Yeah, to detect breast cancer. The other thing would be, the other risk factors I've mentioned earlier.
Okay, so if, let's say I am person at risk, for example, because I have a family history, or I don't want to have kids, right? Are there any measures that I can take to lower my risk of breast cancer?
Yeah, because actually 30% of the risk factors is modifiable. Yeah, so whatever that I said is modifiable, you have to approach those things and you have to reduce your risk in that aspect. On the other side, you also have to do screening because you are at risk. So how old are you? So you're 32, you see you're less than 40, but you're a woman at risk because you have a family history of breast cancer. So you have to go for screening. You have to do a clinical breast examination. If warranted abnormal, then you have to go for a mammogram and ultrasound.
Okay.
Don't wait for 40.
Don't wait for 40. I got it. And also to, of course, practice a healthy lifestyle, right?
Definitely.
Sleep well, have less stress, eat well.
Yes.
Okay. So now let's move on to the next and very important part, which is if in the unfortunate event that you are diagnosed with breast cancer, what kind of support or what kind of coverage that you can get for yourself to help you through this recovery journey. All right. So number one, what's really important in this whole situation is, of course, financial planning. Financial planning here, of course, refers to insurance and takaful coverage, a coverage that protects you before something happens. All right. So I was just talking to Dr. Vicky just now. How much does breast cancer treatment usually goes up to? In my research, it's about 300K, but Dr. Vicky corrected me and said it actually goes up to 500,000. 500,000 is an amount that a lot of us may not be able to make in our lifetime. So it's really, really, really important to get coverage, to get insurance or takaful plans that protects us in any unforeseen circumstances, right? So how can insurance and takaful plans help us is, number one, of course, we have hospitalization bills, we have treatment bills, medical bills. So this, when you get a protection plan that covers cancer or breast cancer, the portion of the medical bills will be covered. So you don't have to fork out your own money. You don't have to worry about the financial aspect. And additionally, other than just treatment and, medical bills and all, you will also get payout. Payout is usually for when when you're already sick and you're recovering, right? So like a lot of things in life will be halted or stunted. For example, if you're sick, you cannot go to work, or maybe you have a family member that has to stop working to help you with your treatment and everything, to take care of you, right? So this payout will actually kind of cover these living expenses. So it's really important to get protected.
So allow me to, jump in, Joey. When we speak about cancer, we've got direct costs and indirect costs of cancer. So the direct cost is what the insurance schemes can cover. So if you take up the cost from the direct cost of treatment, direct cost of, going for regular screenings and diagnoses, and after treatment, you have to check whether the treatment is effective or not. So they have to go for more imaging, more biopsies, lots of procedures, hospitalization. So if that cost is taken up, then they also have to worry about indirect costs. So, insurance schemes that's covering the direct and indirect costs, in my opinion, is an excellent choice.
Exactly. So it's not just about the bills in hospital. It's everything in your
because
life.
they wouldn't be able to work.
Yes, exactly. As we know, insurance and Takaful can provide coverage for hundreds of thousands or millions, depending on your premium. And actually, your premium doesn't really go that expensive. It's in the hundreds or the thousand, depending on the coverage that you take. So if you think about it, 1 month, perhaps you pay 300, right? 300, 300, and 300. You'll never know what will happen to you or to your family members. But if something actually happens, whatever you've been spending is going to be worth it. It's going to cover the millions or the hundreds of thousands that you wouldn't be able to pay otherwise. So we will never know what life brings us, right? We'll never know what our journey will be. It's always important to just be prepared. Pay now to have peace of mind, to have coverage, so that you can live your life to the fullest. I would also like to share that Etiqa actually has specific coverage plans that protects female-related diseases. So it is called the IL Female Essentials. So these coverage actually covers everything that the female might have, like breast cancer or cervical cancer. So if you want to check it out, remember to visit etiqa.com.my for more info. Other than the financial aspect of buying insurance and Takaful, Etiqa also has been working with NCSM for a really long time on a program called the Etiqa Free Mammogram Program. All right, so maybe I'll let Dr. Vicky share more about this.
Yeah, so we are actually at phase 6 at the moment. Yeah, so Etiqa has been kind enough to give us quite a large sum in order to cover screening and early diagnosis of ladies who are at higher risk for breast cancer. So this is mainly targeted towards 40 to 70 years old Malaysian women from the B40 category or household income of lesser than 5,000. So the concept of Etiqa's mammogram screening program is roughly we cover about 6,000 plus ladies in a year, and this is done nationwide. So it's not only Klang Valley. So it's actually to promote health equity and also to improve access towards healthcare in areas where there are no facilities for ladies who can't come. The beauty about this program is Etiqa also covers things such as logistics. So patient transportation to and from the screening center is covered. Food is also covered under Etiqa for that day. And they usually come in buses. They usually come in a group, and they go in buses. We've got panel hospitals nationwide, private hospitals who have signed an MOU with NCSM. So for states outside the Klang Valley, we do it with these panel hospitals. NCSM goes through this Jejak Cancer program on the ground. It's a community cancer and health screening outreach programs. So we do active clinical breast examinations on the ground. So we go to the Orang Aslis, we go to the underprivileged, underdeserved, marginalized communities across Malaysia. So we get the name list, phone number, IC number, and then we pass it to our panel hospitals to expedite the process. So within 7 days, the panel hospitals will give a call to this lady and, secure a mammogram appointment. Within the next 7 days, this lady should go for screening. So in the case that they don't go forth, we will channel these contact numbers to our cancer information system in NCSM. So the CIS, we call them, they will call this lady and they will identify why haven't you gone for your mammogram. That's the next step if they have not gone. So we address their concerns. If it's, money or lack of transportation, whatever, we address it and we ensure they go for screening. Yeah. After mammogram, it doesn't end there. We also assist to do biopsies. Because we call it the triple assessment, clinical judgment, clinical assessment of a doctor, plus the mammogram or the ultrasound for radiographic finding. And the third one would be the histopathological finding, which is the findings from the biopsy. Only then we can arrive to a diagnosis of breast cancer. And Etiqa has been successful enough in all the phases to assist us to diagnose so many ladies with breast cancer.
I see, I see. Okay, so doctor, if there are anyone who's watching this that if they know someone who might need this assistance, is there any way that they can reach out to NCSM or
Either they can go through this toll-free helpline called the 1800 88 1000, that is NCSM's toll-free helpline, or they can just walk into our cancer and health screening clinic in Klang Valley. It's in 66 Jalan Raja Muda Abdul Aziz. So if you want to identify and you're from different states and you want to know which are our panel hospitals, you can give a call to the toll-free helpline and they will direct you towards the necessary panel hospitals across the country, including Sabah and Sarawak.
Oh, okay. So anyone can just call that
Yes.
number and get assistance.
Yes.
All right, cool. All right, so maybe we want to talk about something that's been ongoing. I think the jejak cancer. Is this the same
Pink Etiqa.
Pink Etiqa. Okay, so let's talk about this initiative that has been ongoing, is currently ongoing, which is the Pink Etiqa National Mobile Health Screening Clinics. So maybe I'll let Dr. Vicky share.
Okay, so Pink Etiqa was a program that we have created this year for Pink October. So every year we come up with something special with Etiqa. So for this year, out of the 14 hospitals nationwide, we have selected 6 panel hospitals. These are hospitals that we find, we should improve access to healthcare there, access to mammogram screenings there. So we have picked them up and we have created a puzzle. So we are going on a road tour. Okay, so we start from Aurelius Hospital, Negeri Sembilan. This was launched by the Datin Sri Azlin, who is the wife of the Minister of Health of Malaysia. Yeah, so we have moved on to KPG Sabah after that because this year Etiqa has been kind enough to start screening initiatives in Sabah and Sarawak. Moving forward, we have Salam in Terengganu. Then we have Pantai Hospital Ipoh, Pantai Hospital Perak and Melaka, followed by the last location, which is KPJ Kluang in Johor. The closing is on 5th of November. So the target is about 2,000 ladies to be screened during this initiative in these 6 locations. We are bringing our mobile Etiqa screening clinic down to the ground. So we will do a clinical breast examination and eye breast. Eye breast is also another handheld device that is a non-radiation device. It is done by healthcare professionals and used on the ground where there is no access towards mammogram or screening. So this helps to stratify the risk. So ladies who are eye breast and clinical breast examination positive is directed to the hospital under the panel for the mammogram. Yeah.
So this will be open to the ladies who visit the hospital, or it will?
No, this is open to the ladies who are underprivileged. They are B40 ladies and Malaysian women from the age of 40 to 70. So how we have approached these localities, each location we have gone, we have spoken to local leaders and local NGOs to identify these sort of ladies. And they are the one who's referred to the hospital. It's not a walk-in basis. Yeah.
Okay, so this program is really to help those who do not have the means, right, to get testing or further steps, or even the awareness that something like this is important.
And the first component of this program is health awareness. In all 6 locations, we are giving health talks for breast cancer. Yeah.
Okay, so you heard that. I think with that, maybe just one last question, Doctor. What future aspirations did you think that we can achieve together?
Okay, so NCSM is very glad that Etiqa has entrusted us with phase 6, up to phase 1 to phase 6. So of course, we are looking towards a phase 7. We are hoping to have a phase 7, and next year we are going to come stronger because we are going to expand in East Malaysia. So Sabah and Sarawak has started at some scale this year, but next year we're expanding it. And we are going out to the ground to the aborigines of Sabah and Sarawak. That's how we are going to direct this next year.
Okay, that is very good. Thank you, Doctor. I think we've reached the end of today's session. Thank you, Dr. Vicky, for joining us, everyone.
Thank you, Joey.
All right, hope to see you again, Dr. Vicky. Thanks for the very insightful session. All right. I hope you guys learned something about Pinktober, and remember to spread the pink and spread awareness on breast cancer.
Bye. Bye.